Ovarian cancer. It's often called the silent killer because its symptoms can be so easy to overlook. It's one of the top leading causes of cancer deaths among women, yet awareness, early detection, and support can make all the difference. Let's go on the record.
You're watching On the Record on WPBF 25.
In honor of Ovarian Cancer Awareness Month, you're about to hear from survivors, medical experts, and advocates working to raise, spread all the knowledge and hope about this illness. So joining me now is Dr. Ken Gray. He's a holistic physician, and your patient, Beth Bradley, who recently had a hysterectomy after cysts were found on her ovaries. Thank you both for being with us. Let's start with you, Beth. Can you talk a little bit about your story, your family history, and how you got here today?
Yeah, so thank you for having me. My mother got diagnosed with ovarian cancer, and I lost her a little over 5 years ago to the disease. Like you said, she had no symptoms, we had no family history, BRCA negative, nothing. So I've always been very aware of taking care of myself and having that in the back of my head. So always I do with my annual pap smears, I always ask for a transvaginal ultrasound, which is one of the only ways you can detect anything. And I'm 49, I went this year for my annual, everything was great. I asked for a transvaginal ultrasound. And as I was walking down the hallway, the doctor called me into her office and said she found something suspicious, it was very small, but a very tiny cyst on my left ovary and a small solid mass on my right. So it was very fearful. I was very, very scared. Obviously, it was something I've always worried about, but I had excellent care. If it wasn't for that test, they would have never even found it. So fast forward to me deciding to have a full hysterectomy. And once they did the pathology, I was very lucky to find out that I am completely cancer-free.
Oh, that's wonderful.
Everything is great, and yeah, I'm happy to be here and talk about it.
Thank goodness you knew to ask for that. Dr. Ken, tell us a little bit about asking for that test. I think that being your own advocate is so important. When do we know? I mean, I don't have a history for me personally, but is that something we should all be asking for?
You know, honestly, I'm more preventative, and I would say if that's part of your tendency to get testing, sure. There's a lot of preventative measures, and that seems to be a really good one of them, you know?
Talk about why you were called in to be part of this surgery.
Oh, for me, one of the many reasons, I think, was that Beth, she's a very strong-willed, knowledgeable, amazing individual, and she said, Dr. Ken, this is what's going on with me, and I need you at my side. I want you on my team. I'm like, I'm there, whatever it is. So as we started to talk, I realized that there was, number one, I want to heal well. I don't ever want to go through this again, and I want my recovery to be something that is quick and good, and I just want I want the surgery to be a success. So for me, that's what I looked at. I looked at that list, and that's what we went for. We started working together ASAP.
Before the surgery?
Oh yeah, several weeks, maybe over a month, I would say a couple times a week. To boost her immune system, to balance her inflammatory system, to get her mind right, to lower stress levels, lower cortisol levels, to make the circulation of everything just, so she would respond well.
And why is acupuncture so good before surgery and after?
A lot of reasons. The ones I just listed, really, it's around immune system circulation, lowering inflammation, and expediting the way that the body will heal and respond to trauma. So, I always tell my patients, surgery is still trauma even if it's planned. Your body is still going through that. And everything leading up to it, the stress of having to go through it, the stress of being told all these things and rehashing a painful experience, which was the loss of her mother. So there was all of that emotional content. And so mind body, right, it's a thing. And we're realizing how important that approach to wellness is when you take into consideration your mind, your emotions, body. And so that was my job, was leading up to it, to prepare her on every way.
And so how are you feeling?
I feel amazing. Thank you.
How far past surgery?
Monday, 2 days ago was 6 weeks exactly.
Wow.
And like Dr. Ken said, we did it before, and I've had acupuncture for other things over the years. But I was lucky enough to have him come during the day of my surgery and work with me in the OR. So I just feel very blessed to have my entire team.
And what did your doctor say about your recovery, knowing that he was helping you?
I didn't even know when I went to see Dr. Ken that he had been working with my surgeon, Dr. Pinelli. So I think she was thrilled to have him on board, and it made me feel more comfortable that they had worked as a team together. And I've bounced back quicker than I think anybody thought I would. So.
You're a pioneer at doing this, and as you mentioned, it's becoming more and more popular. People are doing it more. How long have you been doing it, and are you seeing it more and more often?
Yeah, I started first with, I believe it was a colon cancer patient, and then it went on from there. A lot of breast cancer related work, intraoperatively, pre-op and post-op. The intraoperatively is, that's going into the inner sanctum, right? So for a surgeon as experienced and as revered as Dr. Pinelli, to allow me to do that is huge. And it wasn't my first time with her, so I knew to expect a really great outcome regardless. But being part of increasing that result is really wonderful, right? So it's a team effort.
Absolutely. I know that a big part of our show today is talking about prevention, early detection. What's your advice to women out there, and what would you say to them?
Go get your testing, get your pap smears, ask for a transvaginal ultrasound, get tested for everything. If you are feeling any sort of discomfort or anything, trust your gut. You have to be your own advocate, because doctors will not encourage you to get a lot of these tests. They won't. They'll even sometimes try to talk you out of it. You have to be your own advocate.
I love this. It's a team effort. I love the connection, mind and body. It's so true. Thank you both for being here.
Thank you.
Really appreciate it. A great addition to what we're talking about here today.
After 20 years, it just keeps getting better.
I guess so. Thank you so much.
Thank you.
Well, coming up, we hear from an oncology surgeon and an organization on a mission to help cancer patients.
You're watching On the Record on WPBF 25.
Welcome back. Joining me now is Jennifer McGrath, the Executive Director of HOW, which stands for Hearing the Ovarian Cancer Whisper, and Dr. Donna Pinelli, an oncology surgeon who is on the board. Thank you so much for both of you being here today. Let's start with Dr. Pinelli. What are the most common gynecologic cancers that you see?
So the most common gynecologic cancers include ovarian, uterine, cervical, vaginal, and vulvar. And with ovarian, we also include tubal cancer and peritoneal cancer as well.
And Jennifer, you run this organization, and it really spreads awareness when it comes to ovarian cancer. And talk a little bit about the whisper portion of what it's called here, HOW.
So ovarian cancer tends to have very subtle signs, and so it's just really important to pay attention to your body, and if anything's persistent, to definitely get things checked out. And I believe it's called the whisper, diagnosis, because you just don't know those symptoms.
Sure. HOW has created this Angel Fund. Can you explain how that works and how you're able to help so many patients in our area?
So that's part of our mission, which I'm very passionate about. So women that are suffering from ovarian cancer, that are in financial need, that fund will pay their everyday living expenses, so they can focus on the healing and not worry about, if I'm going to make my mortgage payment or utility bills.
They have enough to worry about.
Yep, we step in and take care of it for them.
And doctor, can you talk a little bit about signs and symptoms when it comes to ovarian cancer? I mean, we said some of them are hard to detect, so what do we need to know?
Well, part of the issue with ovarian cancer is usually by the time it has enough symptoms for us to pick it up, it's already advanced. So sometimes there are very few early warning signs. The ovaries by design are very tucked, right? They're very hidden in our bodies, right, to protect them. So some of the symptoms might be something as simple as frequent urination, hesitancy with urination, pain, unusual pain, bloating. One of the most common symptoms I see with patients is a feeling of early satiety, meaning they take a few bites of food and they feel full. And they feel like their stomach is getting bigger, even though they've been dieting and even though they're losing weight on other parts of their body, yet their stomach seems to be getting bigger. These are all very subtle signs, but if any of these signs are happening, and especially if they're accompanied by like severe fatigue, more severe than you would normally have, obviously in our busy lifestyles, and you just have to be aware that if these are persistent signs or symptoms or pains or discomfort with intercourse, any of these things, you need to get it checked out.
Oh, we talked to one of your patients who said she asked for a special test Tell us about that special test, and when is it right for everyone to ask for something like that?
Right. So one of the big challenges with ovarian cancer is there is no good early screening test. We don't have a pap smear for ovarian cancer, not yet. They're working on things like this. But for right now, the tests such as an ultrasound or a blood test called a CA-125, they're often used in patients who have ovarian cancer. Unfortunately, they haven't been proven to be as good a screening test as we would like. But definitely, if someone is having a symptom, is having a problem, that needs to be checked out.
And family history is always important.
Family history is very important because there are many women who may carry a gene in their family that they don't know about that can predispose them to all different kinds of cancers. And ovarian cancer and breast cancer are two of the big ones with the BRCA gene. And if you know you're in a family with a lot of cancer, it's important to find out if there is a gene that runs in your family, because if there is, many of these patients would not only undergo enhanced surveillance and screening, but they may want to do risk-reducing surgery. They may want to take the opportunity to have either their ovaries or their uterus or their fallopian tubes removed if they find that they're at high risk for those types of cancers later in life when they've completed childbearing.
Can you talk about someone who is inspired by what you guys do and they're watching right now and think, wow, I would like to get involved? How can they help? What can they do?
Well, first of all, if they know someone that has ovarian cancer and they are in financial need, please reach out, because we will help them get them through a very difficult time. And of course, donations are very welcomed, whether it's one time or reoccurring. That funds our mission, which is to fund groundbreaking research, helping with the Angel Fund. We do scholarships for Florida medical students who are interested in GYN oncology. And we also do screening for underserved women that might have the BRCA gene. But they certainly can reach out to me, and I'd be happy to get them involved.
Right. One thing I think we want to get across in this show today, and Doctor, I'm going to let you kind of reiterate it, is that those screenings. You have to be going to your doctor each and every year.
I think it's very important to get routine screening tests. And for women, a pelvic examination, whether or not they need a pap test, which the guidelines have changed a little bit in recent years, but all these things are important. But if you're having symptoms, don't wait for your annual exam. Go to the doctor, make a specific appointment for that specific symptom. And if you don't get the answers, or if you're still having a persistence of any of these problems, go back again, get checked again.
Yeah, that's great. Advocate for yourself and make sure you make yourself a priority too. So thank you, and thanks for all the work you're doing. No one should have to go through this alone, and you guys make that all possible. Thank you both for being here.
Thank you for having us.
Well, coming up next, the inspiring story of a local cancer survivor. Well, joining me now is Luis Altiz Isidori, an ovarian cancer survivor. Thank you for being with us. Congratulations to you. I'm so glad you're doing well. If you don't mind, share your journey, share your story from the beginning.
Sure. Thank you for having me.
Of course.
So in December of 2024, I was diagnosed with stage 4B ovarian cancer. And that came as a shock. I don't have a family history, and I didn't have any symptoms at all. There wasn't any of them. So I ended up having a pretty aggressive surgery in January at MSK. And it was a 10-hour surgery that was really a miracle surgery that I had. I after that, was in the hospital for 18 days.
Wow.
I had an ostomy bag. I had cancer was in my colon, my liver, my chest. It was spreading.
When you heard stage 4, what was going through your mind?
So I didn't realize cancer went past stage 4. So when he said 4B, I thought I didn't hear him correctly. I don't know what was that. It was scary because up until that moment, I thought that there was no hope. I didn't realize. I didn't know a lot about ovarian cancer at all. But what I thought I knew was that there wasn't any real hope. So to be here almost, you know, like a year from when my Pap smear was in September, when the whole thing started, and being in remission now, I realized that that's not the case. That you can live with stage 4 cancer.
Wow, that's amazing. And so you had this intense surgery.
Yes.
And then treatment afterwards.
Yes.
What was the treatment
So
after?
treatment was chemo. I did 6 rounds of an aggressive chemo, and I was lucky that I was able to handle it. So I did 6 rounds of chemo. I then got to have my ostomy bag reversed. So that was another great step.
Sure.
And I started about a month or 2 ago, I started a medicine that I get to take for two years that can help prolong life without reoccurrence. That's the goal of the medicine.
Wow, that's amazing. What kept you inspired and strong, and what kept you going?
So during, you know, different things at different times. So right before surgery, I just told myself, all I need to do is show up. I just need to walk through the doors of that hospital and let them take over. And I just kept telling myself, all I have to do is show up at the front door of the hospital. And that got me through that. And I trusted my doctors. And then, you know, after that, through chemo, you're like walking on eggshells. With every treatment, you think, well, this is going to be the one that's going to make me sick. And you realize, well, okay, then I had 2 and 3 in, and I was doing okay with it. I had little tricks like acupuncture, and hydration is huge. I do a lot of IV drips of hydration, a lot of support from friends and family and organizations like HOW, and a lot of prayers, sprinkle in a little bit of luck.
Of course.
And it definitely takes a village. So I pulled from my family. I have a young son, and just watching him and making sure that he got to see me get up every day and get him ready for school.
Yeah.
And send him. Maybe I went back to bed after that, but he definitely got to see a good side of me.
Absolutely. Attitude is a big part of it sometimes.
It is a big part. I'm lucky that I'm in a good headspace. My mind is my best friend right now. And there are definitely moments where you're angry, and you're allowed to be. You know, you get angry or sad, and you have to dig a little deeper to pull yourself out of those moments.
And you took advantage of some resources that were here locally to help you and your family.
Yes, and that has been great. The women of HOW have been a great support. Just as friends, we were able together to do some amazing fundraising work. Something that I never thought. You know, if you talk about what's the silver lining, the people I got to meet,
Sure.
and the people that are reaching out to me on Instagram and saying, well, I saw that you're part of HOW now, and thank you. I'm going to make that appointment. I haven't gone to the gynecologist in a while, and I didn't know this. I didn't know I can ask for these tests. So all of that gives me a little bit of extra. Okay, this is the beginning of my story. It's not the end, and that makes me feel real hopeful.
You know, so it was a year ago that you got that diagnosis. There's somebody sitting at home right now.
Yes.
Who just got that same news.
Right.
What do you say to them?
Well, you know what? As you have a second. You can take a second and take a deep breath and make the choices that feel right for you. You know, talk to your family, talk to your doctors, reach out to that support. But just know that there is hope that you are going to get to the other side of it. It's a journey. It's one that you're going to be on for the rest of your life.
Sure.
And you just need to take it day by day. I try to just live for today. We all should do that. But when you're faced with something like this, you really have no choice but to say, today's a good day. So I'm going to get up, I'm going to get dressed, I'm going to smile, I'm going to be thankful, and you know, I'm going to push through.
Yeah, and now you're giving back to people who are in the same position.
Yes.
So, well, thank you so much for sharing your story. I'm so glad you were
Thank
doing
you.
well, happy
Thank
and
you.
healthy, and we'll continue to say our prayers that it stays that way. So
Yes,
congratulations.
thank you so much.
Thank you so much.
Thank you.
All right, thank you so much. We'll be right back. As always, we encourage you to be part of our conversation and our discussion each and every Sunday right here at 10 a.m. We'll see you again next Sunday.